afternoon, Mr. Desai. My name is Ana Aguayo. I'm a physician assistant student here with Dr. Hernandez.
Okay.
Is that okay if I see you today?
Sure.
Okay. So let me take a seat. So it says here that you're here for some discharge from your genital area. Is this correct?
That's correct.
Okay.
Yeah.
So tell me a little bit more about that.
So this discharge started like 4 days ago.
Okay.
And it's just burning, and also it's like white color.
White color discharge. Okay. So you said it's burning. What exactly is burning?
Just when the discharge is
When the discharge comes out, it hurts? Okay. Can you tell me exactly where it hurts?
like on the penile area.
Okay. Just throughout? Okay. Okay, so you said, when did this start again? 4 days ago? Anything in particular that you were doing? You noticed it when you went to the bathroom or anything?
Yeah, I just, after like meeting up with my girlfriend.
Okay. Okay, so tell me a little bit more about the discharge. You said it was white?
Yeah, so the discharge is white and then it just doesn't stop,
Okay.
It's always like a tiny bit coming out.
Okay. You said it was white. Does it have a certain consistency to it? Like, is it runny or is it like a little bit more chunky?
It's like chunky.
Chunkier? Okay. Does it have a smell to it?
Smell? I think so.
You think so? Okay. And you said you had burning when the discharge was coming out. Are you having any burning with urination?
No.
No? Any pain in your lower back?
No.
No? Okay. So you said that you were with a partner when this first started happening, right?
Yeah.
So are you sexually active?
Yes, I am.
Okay. And is your partner the opposite gender or the same gender?
Opposite.
Opposite? Okay, so she's a female.
Mm-hmm.
And how many partners do you have? Just this one female or multiple?
Like 3.
3 females?
Yeah.
Okay. And do you practice safe sex with all of them?
Not all of them.
Not all of them. So you don't wear protection with all of them?
No.
Okay. And why is that?
Just it feels better.
Okay, I can understand that. But it is recommended, especially when we have multiple sexual partners, to just wear protection to prevent, getting any sexually transmitted diseases from them or to pass them on to them, okay?
All right.
You said no pain, right? But the burning. On a scale from 1 to 10, like how strong is that burning sensation?
Like 3.
3, okay. So you said no pain with urination. Any blood with urination?
No.
None of that. Okay. Good. Have you taken anything for this condition?
No, I haven't.
Nothing. This is the first time that you've seen anyone about this?
Mm-hmm.
And is this the first time that this has happened to you?
Yeah.
Okay. Anything that makes it better or worse?
I haven't tried anything.
So it's just been happening constantly, right? Okay. So have you ever been tested for any sexually transmitted diseases?
No, I have not.
Never? Okay. How about your partners? Do you know?
I don't know.
You're not sure? Okay.
No.
Well, we're definitely going to get you an STD panel run in this visit just so we can know what is happening. Is that okay?
Yeah.
Okay. And I would also recommend maybe having a conversation with the women that you're engaging in sex with,
Okay.
just to let them know that they might be exposed to something and ask them if they're experiencing any similar symptoms and maybe go to their primary care provider and getting checked out. Okay? Are you comfortable with contacting them? If not, we can do that for you.
Yeah, that would be great if y'all can do it.
Okay, and we'll definitely keep your identity confidential. We won't tell them that it was you that had any symptoms. We'll just say that they need to get checked out. Is that okay?
Yeah.
Okay. So just to make sure that I have everything written down correctly, I'm going to summarize what we talked about. If I missed anything or you think of something else, feel free to stop me at any time and correct me or add anything new, okay?
Okay.
So you're here because you're having some discharge from your penis that started about 4 days ago.
Mm-hmm.
You said that this discharge causes some burning throughout your penis area. The discharge is white. It's a little chunky. It has an odor, right? But you said no other pain in your back and no blood in your urine. And you said that you don't know your STD status. So we're going to get that checked out for you today. Anything else that we haven't talked about that you want to add?
No, I think you
Okay.
covered
Any other concerns that you have?
No.
No? Okay. So just because you're a new patient here, I'm going to now ask you a little bit about your past medical history, your family history, and your social history. Is that okay?
Yeah.
Okay, so I'm going to start with your past medical history. Is there any allergies that you're aware of?
No, I don't know.
No? How about any allergies to any medication?
No.
No? Okay. Are you taking any medications currently?
I'm just taking like supplementals.
Okay, what supplements do you take?
Multivitamin and fish oil.
Okay. Is there a reason why you take these? You're just healthy?
Just for health.
Okay, that's really good.
Thank you.
And do you take these every day?
Yeah.
Okay, and it's like a pill, both of them?
The fish oil is like a pill, kind of like, but it's like oil inside it.
Okay.
Like a capsule, and then the other one is like a chewy.
Okay. Okay, both of these are over the counter, you said, right?
Mm-hmm.
Okay. Any other alternative medicine that you practice?
No.
No? Okay. Are you, or have you had any illnesses?
In the past or within like 2 months?
Just in the current or past, any?
No.
No? You're healthy? Been
Yeah.
healthy? Okay, that's good. How about any hospitalizations?
None of them.
Any surgeries?
I've had past surgery. I removed my tonsils.
Okay. And how long ago was that?
That was when I was like 5 years old.
5 years old? Okay. Did you have any complications with that surgery?
No.
And you weren't admitted? It was just an outpatient
Mm-hmm.
type of thing? Okay, good. How about any trauma, serious injuries, accidents, falls, break any bones?
No.
None of that? A little bit more about your reproductive history. Do you have any children?
No, I do not.
No children, okay. And have you noticed any fertility problems like erectile dysfunction?
No,
Do you have any concerns about any fertility problems at the moment?
I do not.
Okay. How about any youth illnesses? I know you said that you haven't had anything recently, but do you remember as a child?
I think I have had in my youth illnesses like chickenpox.
You had all that? Okay. But anything like asthma, mono?
No.
Any infections like that? No? Okay, good. And your childhood immunizations, are they up to date?
Yeah.
And how about any adult immunizations, like the flu shot? Do you receive that every year?
Mm-hmm.
Okay, good. And do you follow up with yearly exams?
Yeah, I do.
Okay. You get like a physical every year?
A physical, yeah.
Okay, that's good. So now I'm going to move on to your family history. Is that okay?
Yeah.
Okay, so we're going to talk about your grandparents, your parents, and any siblings that you might have. Okay.
Okay.
So, any conditions or diseases run in your family?
No.
None at all.
No.
Okay. Your grandparents healthy, both of them?
Mm-hmm.
Are they both living? Both of your
No,
male?
they're both passed away.
Okay. Who has passed away?
My grandma and grandfather.
From both maternal and paternal sides?
Yes.
Okay. And do you know what they died of?
No, I was.
You don't know.
I was like 1 year old.
When they all died, you were young?
Yeah.
Okay. And how about your parents? Can you tell me a little bit about their health?
Well, my dad passed away because of cancer, pancreatic cancer, 2
Oh.
years ago.
I'm sorry to hear that.
It's okay. And my mom, she's still alive. She has high cholesterol.
Okay. So your dad, he passed away with cancer. What type did you say again?
Pancreatic.
Pancreatic. Okay. And how long did he have it?
He had it when he was diagnosed. It was like stage 4. So
Oh no.
yeah, and then there was a time that he was completely good, but it took 2 years.
2 years, but he had a period of remission there.
Yeah, he had a period of remission where he didn't want any chemo or anything, and he traveled to my home country, and then he came back and had progress.
So it was a pretty aggressive.
Yeah.
I'm sorry to hear that. Okay, so now a little bit more about your mom. You said high cholesterol.
Mhm.
She's still living, right?
Yeah.
Okay, and how long ago was she diagnosed with her high cholesterol?
Like 5 to 7 years, I think.
Okay, and would you say that it's controlled? Is she on medication for it?
She's on medication, and then she exercises for it.
Okay, that's good. Okay, and how about any siblings? Do you have siblings?
Siblings, yeah, I do.
Okay, can you tell me about their health?
They're doing well. Yeah.
Any conditions that you can think of?
No.
No, they're healthy. Okay, that's good to hear. So now I'm just going to talk about a little bit more specific conditions, just to make sure that we cover everything and that maybe we don't forget to talk about something. Okay. So how about any heritable illnesses like sickle cell, anemia, cystic fibrosis? Okay. Aside from the high triglycerides, any diabetes?
No.
Hypertension,
No.
high cholesterol. Okay. Any pregnancy-related issues in your family? Anybody struggle to get pregnant?
No.
Okay. And how about any psychiatric diseases? Like
No.
anxiety, depression, schizophrenia, dementia? No. How about any drug or alcohol dependence?
No.
No. Okay. And how about any toxic exposures?
No.
To like lead, asbestos, anything like that? No. Okay, good. So I'm almost done getting all this information from you. Now we're gonna go into social history. Okay, is that okay?
Okay.
So tell me a little bit more about your day-to-day life.
Daily life. So I'm a student. So I wake up like early in the morning around 5 a.m. Eat breakfast,
Mhm.
and then pack my lunch and go to school, and then till like 5:30 p.m. and then come back home and then repeat the same thing.
Oh my gosh.
Mhm.
So you're a student. It sounds like you have long days.
Yeah.
So what are you studying?
I go to a PA school.
Okay, wow. You're a smart guy, huh?
I don't think so.
Oh, you have to be smart to be in that program, so I'm sure that you're very bright. Congratulations for being accepted.
Thank you.
Would you say that you're stressed out a lot in school?
I am, yeah.
You are? Okay. And do you feel like you have a good support system at home?
I do, yeah.
Okay. Do you live alone or who do you live with?
I live alone
Okay.
with my roommate.
Okay. And this roommate is not a family member?
No,
He's another student with you in the program?
another student. Yeah.
Okay. So you live away from your family, but do you feel like you can contact them in case you're
Yeah,
super stressed? Or
They're
anything?
always like calling. We have this group chat.
Oh, that's awesome.
Yeah,
That's good. Okay, so you said that you cook your own breakfast, you cook your own meals. So tell me a little bit more about your nutrition.
so in the mornings, I make some oatmeal
Mhm.
with some almonds and an apple and some tea. And then for dinner and lunch, I do chicken with rice and vegetables.
Okay. And you eat this on a regular basis.
Mhm.
Every day, same thing. That sounds like a pretty good, healthy, and balanced meal. So that's really good. How about any exercise? Do you have time in your
I don't have
program?
time, so I try to make time.
Okay, that's good. That's important. You know, any little small, any little thing that you can do makes a big impact. So taking the stairs in school instead of taking the elevator, you know, parking a little bit further away in the parking lot and getting a longer walk to class. Any of those little things add up. So, but that's good. You sound like you're a pretty healthy human, so that's good. So how about any like smoking? Do you smoke or drink alcohol?
No, I don't.
You don't smoke. Okay. How about alcohol? Do you drink?
I drink socially.
Socially, okay. What do you mean by socially? How often?
Maybe every 4 weeks.
Okay. So this is only like on the weekends, or
Yeah, it would be on the weekends.
okay. And when you do drink, how many glasses or drinks do you think you have?
Like 4 mixed drinks.
Okay. But again, nothing regularly, just very.
Yeah.
Okay, but you don't have too much time with school to
Yeah.
be going out and partying, huh?
Yeah, I haven't had that time.
Okay. Alrighty, well, I've taken all the information that I need, so I'm gonna go and review your case with Dr. Hernandez, and I'll get right back to you.